Hi, my name is David Emerson. I'm a long-term myeloma survivor, myeloma cancer coach, and director of People Beating Cancer. Welcome. This vlog post is about myeloma and pernicious anemia and low levels of B12 in our bloodstream. B12, according to research, is similar, in my view, in my opinion, to vitamin D, D3. There are a host of studies that are a little bit cagey. They draw a relationship between low levels of B12 and vitamin D3, but they don't go so far as to say low levels of B12, vitamin D, cause multiple myeloma. They might say their low levels are associated with myeloma. They might say low levels increase the risk of getting multiple myeloma. Further, it's not, as far as I can tell, it's not a part of the usual standard testing that your oncologist will do to keep an eye on your multiple myeloma or to determine if you have myeloma in the first place. In other words, of all the things they test in your blood, urine, and imaging studies in your bones, there is not usually a test for levels of B12 in your bloodstream, nor for vitamin D, D3. I myself check. I go to my local. I get do-it-yourself DIY blood testing, fairly easy and inexpensive, for vitamin D, D3. I've never had my B12 tested, but I've had people contact me and they talk about pernicious anemia. They've determined they have low levels of B12. What do? All I know to do as a therapy is to supplement with B12. Determine, and this is an important point, it's not enough to figure out, to ask how much do I take? What's the dose? Every person ingests a supplement differently. So I was just communicating with a fellow multiple myeloma patient the other day. He, actually it's his wife, he's the caregiver, she's the patient, supplements about half of what I do, and this is for vitamin D3 now, yet we both have pretty much identical serum blood levels of vitamin D3. The same thing probably will be true with B12. You don't know how much to take until you determine what your blood levels are. If you supplement with X, what will that do for your bloodstream? All to say, vitamin B12, its relationship with myeloma and pernicious anemia, it's there, it's just not a solid relationship. The presence of it, the tests for it, how much one person, or what the therapies are, it's tricky. Yes, be aware of it. Yes, read the blog post. Yes, learn as much as you can. You, the patient, though, have to be somewhat independent. Certainly talk to your oncologist. Ask all these questions. Don't be surprised if oncology is not thorough in their identification studies, therapies, etc. It's not unlike diagnosis of pre-myeloma, MGUS, or smoldering multiple myeloma. Oncology doesn't have all the answers, and that's fine. There's no surprise about that. That's not awful. So, pernicious anemia, low levels of vitamin B12, supplement with B12, have your blood tested, determine what your levels are, determine what to take, how much to dose, and test after to see if your blood levels increase for B12, and if that helps your anemia. If you have any questions, I know this is complicated. If you have any questions, scroll down the page, write a question or a comment. I will reply to you ASAP. Thank you for your time and attention.